Hi, my name is Lindsay Price, and I will be presenting our case study, which involves the pharmacist interview process. We will be interviewing Dr. Penicillin for a pharmacist position at our independent pharmacy, Main Street Drugs. When preparing the interview, we considered the following resources: position description, resume, the EEOC guidelines, the candidate interview, and Dr. Sillin's references. The position requires a Doctor of Pharmacy degree from an accredited college of pharmacy, an active license in the state of practice, and 1 year experience in community pharmacy. Previous manager experience is preferred but is not required. Professional responsibilities of the job include accurate compounding, filling and dispensing of prescriptions, performing drug utilization reviews to ensure patient safety, and counseling of patients on the use of both over-the-counter and prescription drugs. Qualified candidates will also be involved in working with pharmacist interns and rotation students and the developing and implementation of other value-added services. Managerial responsibilities would include carrying out some standard operating procedures such as inventory management and billing. The candidate would also be expected to perform manager duties when the manager is not present. We would also like our pharmacists to stay up to date with the world of pharmacy through continuing education programs and by being involved in local pharmacy organizations. All in all, we want to hire a dependable pharmacist who shows professional pride and attitude, is courteous to staff and patients, and who is a motivated self-starter. As you can see from her resume, Dr. Sillin has been involved in many types of pharmacy. She's been involved in independent and large chain pharmacies, nuclear pharmacy, and teaching. She holds the required PharmD degree from Creighton University, and she also attended an MBA program at the University of Minnesota College of Business. And she has received honors within her profession, and she's been a guest speaker for pharmacy associations. Before we started our interview, we had to go over EEOC interview guidelines. We have to comply with these guidelines, and the purpose of them is to protect the privacy of our candidates regarding personal information that is not work-related. So we are not allowed to ask questions about protected information, which includes age, gender, race and appearance, citizenship, and health status. Complying with these regulations will also protect our business because violations are against the law and can be punishable with large fines. After those guidelines were reviewed, we came up with some interview questions. The first set of questions were those that were specific to resume information. Some of these included, I see you are involved in several pharmacy associations. What are some of the experiences you have had that encourage you to remain an active member? And what aspects of working as a relief pharmacist do you like and not like? Next, we asked questions about job effectiveness. These questions included, please describe one of the pharmacy programs you implemented of which you are particularly proud. And please describe a situation where something did not go as planned and how you overcame that obstacle. We also wanted to assess her job motivation. So we came up with questions like, you have been working as a pharmacist since 2000. What is it that keeps you interested in the pharmacy profession? And a manager can make work a fantastic or miserable experience. What attributes or qualities would a manager need in order to motivate you and make you look forward to coming to work? Next, we consider questions about managerial experience. We ask questions like, please discuss a situation in which you had to make a hard decision that some of your staff disagreed with, including how you ensured compliance from those who did not like the decision. And what qualities did you look for in a new hire? What qualities do you think you possess that make you an effective manager? We also wanted to ask questions about attitude. So we asked questions like, Please describe a time when you encountered a difficult patient. How did you deal with this? And please describe a situation where you were not able to resolve a problem with a difficult patient. What effects did this have on you and other members of your team? We asked questions about education and training. Some of these questions were, you've been pursuing interests other than community pharmacy for some time. What made you want to come back? And how have you been preparing for the demands of a retail job? And what made you decide to pursue an MBA after completing your PharmD? Finally, we asked questions about our company, Main Street Drugs. These questions included, what do you know about the population we serve in our pharmacy? And what programs would you be interested in starting at this pharmacy? Along with the interview questions, we also had references to consider. Dr. Sillen had experience in many types of pharmacies, and many of her former employers had positive things to say about her. At Independent Drugs, the owner was impressed with the education and monitoring services she'd started. The owner said she'd helped increase sales while she was there. Other employees highlighted the success of programs she had implemented, such as her smoking cessation program and related presentations, and the start of continuing education programs while she was an instructor. This was a lot of information to go over, but we had to assess it, and it was time to make a decision. We liked many of the things that Dr. Sillen had to offer. She satisfies all the job description criteria, and she has plenty of experience. She's also active in volunteering with pharmacy associations, and her references had very positive things to say about her past performance. We also had some concerns, though. On paper, she seemed to be a job hopper, but after learning more about her, we were satisfied with the reasons behind these changes, so we didn't worry so much about that. We also worried about the lack of potential for advancement for her at our pharmacy, but she'd expressed a passion for independent pharmacy and interactions with patients, and for the chance to develop value-added services. We feel like these are things our position can offer her. Ultimately, we decided Dr. Penny Sillen would be an asset to our pharmacy, and we extended her the job offer. So welcome Dr. Penny Sillen to Main Street Drugs.